Hello, everyone, and welcome to another live session of A Day with your Fertility Specialist. I am going to be your host for today, and my name is Kadili Sabinam. And joining us here today is the wonderful Dr. Jane, a minimal access surgeon and a consultant gynecologist here at Alps Hospital. It's nice to have you here once again, ma. Thank you for joining us.
Thank you for having me.
You're very welcome, ma.
Thank you.
And on today, we're going to be talking about PCOS or the new name PMOS, polyendocrine metabolic ovarian syndrome. But before we dive into our topic for today, I want you to share this link to someone that you know. These sessions have been very, very impactful and are very wonderful knowledge sharing sessions. So I want you to share the link to somebody you know. Tell somebody to join us today, and also share the link on your status to somebody you know who will need this information. So now, Dr. Jane, we had this live session on Wednesday where you talked about briefly about PCOS, now PMOS. So I want you to briefly recap what was said on Wednesday for those that are just joining us newly.
All right. So PCOS to PMOS, well, polycystic ovary syndrome and polyendocrine metabolic ovarian syndrome. Well, there is following a global consensus among clinicians, researchers. There's a drift to rename there's this drift to rename the condition as PMOS. Well, this is from better understanding of the condition. Formally, well, better understanding of the condition. Over the years, clinicians and researchers recognized that the condition was more like a lifelong condition that encompasses more organs in the body. Metabolic functions are affected, endocrine functions are affected, even the ovarian functions are affected. But this condition was somehow narrowed because of the name. So the name was misleading because every once people hear polycystic ovaries, a lot of people assume they have cysts and all of that. But what we know is that most people with PCOS don't really have cysts. What they have, they are tiny follicles, fluid-filled sacs that either in growing follicles or arrested follicles at some point. So with this misnomer, a lot of times there's mistreatment, underdiagnosis, fragmented care. But with this new name, it encompasses all the conditions: the heart, the skin, the hormones, and ovaries. So now the care is better, people understand more. So the clinicians, you don't have to dismiss a woman's experiences because you assume she doesn't have PCOS. Now you can pick her the points where her concerns are more with the tags that come on the skin and all of that. So the dermatologist will manage. So multidisciplinary care now. And so patients tend to get more, of course, better satisfaction. So that's the essence of the new name change.
So basically, this new name change now is covering a broader aspect of female productive health, not just the fertility side of it. It's
Yeah.
now covering the metabolic part, the endocrine part. So I want you to briefly tell us, like, break it down little by little for the viewers and for most of us that really don't understand the whole medical jargon surrounding polyendocrine metabolic syndrome.
Okay, so as you said, PMOS, polyendocrine. So when we say polyendocrine, means endocrine means hormone producing structure, the hormones generally. So now you see in PCOS, what we know, there's high levels of male hormones, excess of luteinizing hormones. All these are things that can affect your reproductive function. Now, the other hormones that are also affected in the body aside these regular ones. So the androgens and all. So we don't want to limit our condition to just the um, polycystic ovaries as it were. Then, and even insulin resistance that is commonly featured, you see, that is kept behind, even though we give some other medications to help improve that. But people don't see that because those insulin resistance that eventually lead to the diabetes that a lot of these women are predisposed to. So for the metabolic, of course, a lot of metabolic functions, there's a place where the heart is affected, the liver and all, even the diabetes we mentioned. Now, The ovaries too, ovarian syndrome, not taking it out completely because it's still a component of the condition, so it's still there in the name. And of course, even the metabolic functions, the skin tags and all, commonly you see in insulin resistance. So the name encompasses most of the experiences or conditions women with this syndrome would have. So it gives better care and quick earlier diagnosis.
Okay, so I know we are mostly fond of diagnosing ourselves from ChatGPT and other Instagram doctors, but I want you to tell us, from a medically informed point of view, what symptoms women should look out for when it comes to PMOS now.
Well, the big common symptoms, a lot of times people don't get to see some of these conditions except when they are trying to get pregnant, fertility becomes an
Okay,
issue. When they are beginning to seek care, then you now see some of these things featuring these conditions featuring in their evaluation, your discussion. So commonly you would have women with irregular periods or very long, and so any woman that sees period less than 8 times in a year. Yeah, so you see, if you have a long menstrual cycle length, more than 35, automatically you are not seeing period every month. Automatically, that gives you less than 8 periods in a year. Now, women that have that, or women that have features that shows that they have a lot of high levels of androgen. Androgens are male hormones, and they can feature like women having hair on their
okay,
chin, excess body hair, chin on their chest, and all of that. Sometimes you see women have male pattern balding, that they are
mm,
bald. Then acne too, they are not responsive to medications, very bad acne. They can be one of the presentation. Of course, these women can also present with infertility, fertility challenges, and all. Then for those that probably have walked through this stage, never sought care, sometimes they can come down with the complications of this condition. Like they can have their heart conditions. Sometimes they are in the long term they are predisposed to uterine cancers. They can have this because there's what they call obstructive sleep apnea, like very bad snoring that can be injurious to the heart. So all of these things, you can have any of them while evaluation, but most of it, why it looks like a gynecological condition is that most of the time the women are seen at the point of fertility workup.
team. Wow, it's so sad to see that this condition affects a lot of the parts of the body. You mentioned PCOS causing, leading to, in the long run, leading to cancer. That is really sad. So I want to ask: is there a cure for PMOS now, as it's called? Is there a cure?
Well, there is no, you wouldn't say there's a cure because from the way you acquire this condition, most of this genetic, of course,
Okay,
transferred within families. And of course, you can just have someone have it for the first time, though. But when you say cure, we don't have cure, but for every condition you have, it can be managed.
okay,
And of course, the care for the individual is individualized. So someone comes, her concern is menstrual irregularity. So you give her medications or manage it to a point where she has regular periods. For someone that comes with issues with conception, fertility, you manage to that point. Some are just concerned because of the excess body hair they have. So you manage that condition, which you call hirsutism. Then, so acne, what they call pimples, if you have that, you manage. So you manage the condition per symptoms the child, the individual presents with. That's what symptoms bothers you the most. So you manage that. Then of course manage holistically with other complications in mind.
okay. Okay, can weight loss be a form of management for PMOS?
Yes, weight loss is very significant in the management of PMOS. Well, um, the average woman with PMOS might be overweight or obese. So, and with this weight, you can have hormonal imbalances that can
Okay.
affect your cycles, your hormone functions, and all of that. So, as little as 5% drop of your weight can improve the status of your hormones and also lead to regular periods. Of course, regular periods sometimes can be a marker of ovulation too.
Wow. So does it mean slimmer women can't have PMOS?
Yeah, so that is where, yes, even though weight loss is an important thing or something very important in the management of PMOS, yeah, we can also have average size or average weight women, or as I said, slim women with PCOS, yes,
Okay.
or
Okay.
PMOS.
Thank you very much, Dr. Jane. So, if we have any questions, we can drop them down in the comment box below, and we'll be swift to respond to all your questions. So, now let's talk about PMOS and fertility. What treatment or what angle do you come in from as a fertility doctor when you're treating women with this condition? What do you tell them? And let's talk about women that have to deal with that already have this insulin resistance or already overweight. What are the first steps in their treatment before we begin the main IVF or IUI processes?
Well, so for women with fertility challenges, they need to be fully evaluated. Now, you need to come to a point where you have excluded every other cause of infertility. Then you label it on PMOS or PCOS. Then you offer care as appropriate. Now,
Okay.
for so full evaluation, it means you are taking your history, you are looking at their hormones, you are looking at other hormones that can affect fertility, you are looking at her partner to the sperm qualities and all of that, looking at her
Okay.
tubes if they are patent or not. Having excluded all of this, mean that they are all normal. Now we know that PCOS causes anovulation. Anovulation, I mean, most women with PCOS will not release eggs, and for those that do, they don't do that in a regular pattern. So you
Okay.
cannot. That is why they cannot track their fertility window and all of that. So they need to understand. Once you understand you don't release eggs, and we have come to that point, then for them, sometimes you want to do what we call ovulation induction, and we have a lot of medications that can be used for this management.
Okay.
Now, you give those drugs for them to ovulate. Now, for the insulin resistance, yes, what it does, it stimulates the ovaries to produce more of the male hormones, and those hormones affect they arrest these follicles. You know, normally for women, these hormonal imbalances that we talk about is that in a regular cycle, a dominant follicle grows and eventually releases an egg.
Okay.
But in PCOS, this synchronicity of the follicles is lost. So most of them, you just activate a lot of follicles. What we see that gave the name the polycystic ovaries. A lot of follicles are activated, but most of them are arrested because even though we need a little bit of the male hormones for maturity of these eggs, but you have a high level, and
Male
this causes an
hormones.
arrest. So for them, and these male hormones, insulin triggers the ovaries to produce more of this. So with this what we do for them, there's also a drug that can control this insulin resistance, and that improves the chances of them ovulating, releasing eggs, and getting pregnant on their own. If that doesn't happen, we go to ovulation induction where we give medications. Aside medications, we also have some minimal access procedures where we call what we call the laparoscopic ovarian drill.
Okay.
What it does, it punctures holes on the ovaries, reducing size, reducing the male hormones. You know, when you have it, when you give those holes, it helps to reduce the male hormones. For some, if they go ahead to have regular cycles and eventually get pregnant on their own. Then, having done this ovulation induction, giving those other medications that will improve insulin resistance. You can also try some fertility treatment for them. So these women, they can also benefit from what we call intrauterine insemination, or what we do is to, since we have established that she has a functional tube, we try to induce this ovulation and see if we can inject the sperm at the time is
Okay.
expected for her to ovulate, with monitoring and helping the eggs by giving other injections or drugs to help the ovulation
Ovulation
process.
process.
So
Yes.
if you do that, some of them go ahead to get pregnant, which is also an option. So, and finally, we also have the IVF for them, where you can, in IVF, you also cause artificial, the fertilization happens outside. We monitor the eggs, get them, also inject the sperm to the eggs at specific days and time, and fertilization happens and they get pregnant. So these are options. And of course, for some reason, Also, surrogacy is also an option for them.
Okay.
Yes, if we've had it, we failed severally, and you want to try other options, why not? So long as it's in tune with the laws and customs of the states, you can go ahead and have that also.
Very, very insightful, Dr. Jane. Thank you very much. So, I want to talk about this other last parts, PMOS and mental health. I know a lot of times I'll see on Instagram that men will be saying women act irrationally sometimes. And I know from these studies, PMOS has been seen, PCOS has been one of the reasons women have terrible mood swings. So, how do you manage these mood swings when you have PMOS?
Well, PMOS generally it's said to affect also the mental health. While we're listing all of those, the skin and all
Symptoms,
of that,
yes.
yes, is it someone that the whole problems or the things that you can have when you have PMOS can on its own weigh anyone down and by extension affect your mental health in different ways. A woman trying to conceive, that is already a lot of anxiety, a lot of marital disharmony, and all of that in her home. A young girl having irregular
Periods,
periods,
yes.
very bad acne, affecting her aesthetics, her appearance.
Confidence
So
too.
body image is already, she's obese, she's on the big side. So your image, your confidence drops. All this makes you withdraw and all of that. Then the other the fact that you can't get pregnant when you want it and how you want it, you can't track your cycle, you can't plan. All of this put together can weigh anyone down, affect you mentally, and you know that now affects your social relationship. When your mental health is down, sometimes your relationships, your
So it's affecting,
associations get
yes.
to suffer, even though it's from a point of lack of understanding from others. Because when you don't know what you're going through, sometimes the truth of the matter is that a lot of times people respond to these hormones not because they are aware that they are acting in that way, but it's just the hormones acting. So that you see someone behaving irrational today, tomorrow, next tomorrow, the person is all nice and normal. Sometimes this is what's playing on, but at the time it's happening, they might not have an idea of what's happening. So it's just their hormones playing a whole lot with their psyche. And it takes a whole lot for people to understand. You need to understand, but the knowledge is still spreading. Hopefully, people get to the point and understand what women go through.
Well, hopefully, we all get to the point where we finally understand and we can um, source for information about what is going on in our bodies. So, my final charge to you today is PCOS, PMOS now is not a death sentence. It can be managed, as Dr. Jane said, with proper medications, guardians, and counseling. So, if you know anybody that is having any of these symptoms she mentioned, either the mood swings, the weight gain, sometimes acne too, as she mentioned, if you know anybody or if you yourself is dealing with any of these symptoms, you can book a consultation with us. Our numbers are displayed on the screen. You can book a consultation and talk to our fertility specialist here at Alps Hospital. I'll be very, very glad to help you on this your journey. Once again, thank you very much, Dr. Jane, for joining us and sharing your wonderful knowledge with us today. Um,
Welcome.
make sure to join us next time and make sure to share this link with somebody. You can also go back to watch it and listen and see if it tells you anything you have been experiencing or if you know anybody that has been experiencing these symptoms. And see you next time. Bye.